Now we have Lynne Edwards, who's coming to speak with us tonight about Donayre Cancer Care Center and her role as the cancer care nurse navigator and what she's doing out in the community to teach cancer awareness and screenings and kind of navigating patients that come through the Donayre Cancer Care Center. For a warm, moderator, welcome.
I started at the hospital when we opened the new urgent care center, and then in July of last year I had the opportunity to move over to the cancer center when the hospital received a Susan G. Komen grant. The hospital received a $50,000 grant for a person to go out into the community to educate people on breast cancer, on breast health awareness, and we were able to offer free mammograms to women in the community. So with the grant, our goal was to educate 400 women in the county on breast health and to get as many women as we could in for their mammogram screenings. Through Levine Cancer Center in Charlotte, we're able to provide genetic counseling to women in this area. And the genetic counseling is done virtually here at the Cancer Center. When they do the genetic testing, though, they're not just looking at breast cancer, they can look at 42 different genes, so they can also give you information about your likelihood of getting colon cancers and some other cancers as well. Lisa Thomas, who was the director of the Cancer Center, and I were at a meeting in Wilmington back a few months ago, and one of the ladies there was from New Hanover Hospital, and she was excited because they had just gotten the ability to do 3D mammograms, and that's something we've been doing at our hospital for some time now. So they were real excited about that, and I was excited to tell them that not only could we do 3D mammograms, but we could do 3D breast ultrasounds as well. When comes in and she has a breast density of a C or a D, then she's eligible to have the automated breast ultrasound done. And what that does is it allows the radiologist to get a better look at the breast tissue, because if you have very dense breast tissue, it's harder to detect if there's any abnormalities in that breast tissue, and it might not always be picked up on the screening mammogram, but if you have the dense breast tissue, then you can have this done at the same time that usually at the same time that you have your mammogram done, because the tech will tell you at the end of your appointment that your breast density it's A, B, C, or D. So if it's a C or a D, then you qualify to have the ABIS done. So
anything you can get at the hospital for $100 is a D.
The ABIS is very different from the mammogram. It doesn't compress your breast. It doesn't hurt. If you look in the brochure, you actually just lay flat. You lay on your stomach on the table, and there's kind of like a well in the table, and your breast just lies in that, so there's no compression there. It's painless. I'm happy to say that we have this, and no other hospitals in the area have it. Wilmington doesn't have it. Lumberton doesn't have it. So it's something that we have right now that's unique to us. I disagree, because I think, and Dr. Bostug probably agrees, that if you find any kind of lump in your breast, I mean, you don't know, there's no way you can know if it's cancer or not without having some testing done.
Treatment there also?
At the Cancer Center, we do treatment. We do chemotherapy. We do not have radiation at this point. That's something I don't know if we'll be able to get locally. It's something we really need locally, because it's a burden for our folks in our county to have to travel 45, 50 miles to get radiation. So it's something that we need. I just don't know.
Well, I'd say that's something that we're looking at. We watch and be able to offer that in right now. It's a certificate of need issue with the state. The state, they do their annual assessment of for health care. Right now, they're saying that there are enough sites within the state to meet the need. So we're looking at options of apply for a rural extension.
Lumberton.
Do you do other treatments like infusions for iron?
Absolutely. We do iron infusions every day. We do. We do that. We do injections like Prolia injections, antibiotics. We do those on an outpatient basis. Like if you go to your doctor and you have an infection and he says you need some IV antibiotics, you can come in and we can do that. All right, thank you.
Before I get